Showing this and every Wednesday at 4 p.m. on vibetownmedia.
Good evening, viewers. Welcome to your number one health show, Health Zone, on Vibetown Media. Today we are discussing diabetes, and we have in the house Dr. Yusuf Yakub, Medical Director of Kojach Medical Center in Accra. Welcome to Health Zone, Doctor.
Thank you very much. Okay. Really appreciate it.
Yeah, so like I said, the topic is diabetes. So we go straight to the point, and then we see how far we can delve into the issue on diabetes, and then talk about it as much as we can in a very short time. Yes. So, Doc, what is diabetes?
Okay, thank you for the opportunity, and I would like to say hello to our viewers out there. As introduced, I'm Yakub, and I work with Kojach Medical Center as the medical director and also the consultant for the facility, in-house consultant. When it comes to diabetes, it's a word we've heard a lot, and basically in the most simple terms is our body's inability to regulate sugar or manage sugar. That's in the most simple terms. It's a chronic condition which is characterized by our body's inability to manage or regulate sugar.
Okay, Doc. So are there any things that cause, are there some causes, specific causes for this condition, diabetes? Okay,
largely, some of the things we look out for when it comes to the causes of diabetes are primarily genetics. We find out that there is a strong linkage between people who have a family history of diabetes. When I say family history, I'm referring to if your mother had it, or it's a disease that runs through the family. Growing up, you heard your grandmother had diabetes or grandfather had diabetes. The likelihood you are going to develop diabetes is very high.
Okay.
Secondly, lifestyle. Lifestyle is one of the factors we've also noticed has a strong connection to people who develop diabetes, like being overweight, being obese. Some of these things contribute strongly to people who develop diabetes. Then we also have instances like smoking. Smoking has been known to be linked to development of diabetes. But in all this, one of the strongest factor is lifestyle.
Okay, so in all this...
in all this, one of the strongest factor is genetics. Yeah.
Okay, so how would one know if he or she has diabetes? I mean, someone who hasn't been diagnosed and probably has developed the condition along the line. What would happen to the person? How would the person know something is wrong with me, or I'm probably developing this condition? So I want them to know, so that if the person is at home and probably having those feelings, the person would know perhaps it's diabetes knocking on the door or something.
Okay. For most of my patients that I engage, largely noticing that our location, we get a lot of people who are not so educated.
Yeah.
You have to speak in local parlance and usually ask them in tree. You try to find out how regularly they urinate, because one of the things to look out for if you've developed diabetes is the frequency of urination. You urinate very regularly. You sometimes would also get hungry very quickly. You finish eating, not long after, you're hungry again. This is one of the signs to look out for. Thirdly, there is something called tingling sensation. Tingling is when you feel sometimes some kind of numbness or some pinpricks at your feet or your palms. Usually people come and tell you they feel some numbness in their palms or numbness in their more professional term, extremities, which is your feet and then your hands. When you start experiencing these symptoms, it doesn't automatically mean you have diabetes, but then these are some of the indicators to look out for. And once you start having this, you need to go to the hospital where a test will be done to effectively diagnose you of diabetes. You do not conclude you have diabetes because you have one or two of these symptoms, because there are other conditions which could cause it. But once you start experiencing it...
So you are saying there are other conditions that might give the same symptoms?
Yeah, for example, tingling sensation. Shortage of certain vitamins could lead to certain tingling sensation. And then there are other conditions, as I said.
Yeah.
But then if you have those conditions, it doesn't automatically mean you have diabetes. So you have to go to your healthcare provider, you have to go to a hospital where they check to confirm if you have diabetes. So a doctor would diagnose you of diabetes and then we take it on from there.
Okay, so with the diabetes,
Yeah.
are there various types or it's just a straight jacketed?
No, it's not
Diabetes,
straight jacketed.
yeah.
When it comes to this condition, which is metabolic in nature, there are two main types. So there's a third one, but there are two main types of diabetes. The first one is called type 1 diabetes. And the problem with type 1 diabetes is your pancreas is unable to produce insulin. Either your own body attacked the cells in the pancreas, destroying them, and your pancreas is unable to produce insulin, or you have type 2 diabetes where even though insulin is produced, your body is unable to use it. There's a third type. It's called gestational diabetes. Gestational because it happens when you are pregnant, and which in most cases almost always resolves after you give birth. So pregnant women have been known to develop some kinds of sugar disorder, which is called gestational diabetes. And then after they give birth, it resolves mostly. But then this particular type is called gestational diabetes. Yeah.
Okay, so I would like to know if the condition is treatable, like you can treat it completely.
Okay. Yes, diabetes is treatable, but then doesn't have a cure. It's treatable in the sense that you can be normalized. Your sugar management can be put within acceptable range. But then, for the condition to be completely cured, there hasn't been any successes with that. And when we say treatable, it comes with a series of management plan. Your healthcare provider, who is the person you go to if you have a health condition, is the one who usually puts you on some of the treatment plan. What works for person A might not work for person B, because there is a series of combination of medications and other things. I'm sure the interview will get to that point, and then I'll throw more light on it.
Okay, so on Health Zone, we usually like to demystify myths or confirm some of them. So there is this myth out there that if a man develops diabetes, the person becomes impotent. So what's your take on that?
When it comes to the issue of impotence in men, a lot of factors contribute to impotence. Now, men who are above certain ages, from 45, 50 going, their male hormones start to decline. Your body produces less male hormone, testosterone to be precise. There is a condition called andropause. When a man is around this age bracket, even without diabetes, could have challenges with erection.
Okay.
Now, when there is diabetes, there is something diabetes does to the body. It also has a way of affecting your nerves. It's the reason why you have tingling sensation as one of the symptoms of diabetes.
Okay.
You would know that most of our body functions are coordinated by nerves. They're like the body's wiring system. So if diabetes affects the nerves negatively, that's the firing of the nerves negatively, it could contribute to erectile dysfunction. This is the reason why a lot of men growing up, they tell you to take very good care of yourself. Obesity, being overweight, etc. Because so you don't develop diabetes if you have a genetic predisposition. That's in your family, there is a history of diabetes. You do well to protect and manage yourself well so that you don't develop diabetes. Because around the time you might be developing diabetes, you might also be entering andropause, where your hormones are declining. So that is two negatives as far as erection is concerned, and could actually go a long way to mess up your potency. So do well not to get it, because once you have it, it's of course going to complicate your sexual function.
Okay, so one with or without diabetes, at a certain age, you experience a decline in hormones,
Yes.
and you may have erectile issues.
Yes.
Okay, then on the other hand, diabetes also comes in that might worsen it because of nerve issues and all that.
Yeah.
Okay, so I don't know if we should say we've demystified it or we've confirmed the myth. I think we've halved it.
Yes.
We've halved it instead of 50-50. with or without diabetes, you can still develop that. But at the same time, we can't say diabetes won't lead to that, because it eventually eventually leads to that.
Yes.
That's okay. So you are about to take us through the treatment.
Yeah, for treatment plan, as I said, the best person to speak to is your healthcare provider. Whether your choice is herbal or orthodox, do well to see a certified professional. They would monitor your blood sugar level over a period of time. And people easily fall for adverts which claims to cure diabetes. I've been working with a lot of senior colleagues, medical professionals, specialists. It's a question I always ask. I just ask randomly, hey, in your practice, have you seen somebody who, whatever medication they claim to have taken outside of standardized medicines, either orthodox or herbal, which cures diabetes? Almost everybody tells you they've not seen a case. But then we still see people who argue that they can cure it.
Okay.
Now, the best case scenario that we can have is you bringing your sugar level under control. Your fasting blood sugar, which is the sugar within your blood before you've eaten in the morning, is what your healthcare provider monitors. They ask you to either buy the machine if you can afford it, or they tell you to come to the hospital in the mornings to keep track. They can monitor your sugar level for a period of a month, monitor your eating habits for a period of a month. They give you recommendations and advice on what to eat and what not to eat. Certain people eat certain foods which are low in carbohydrates and high in fiber. So you eat a lot of whole grains, you eat a lot of carbohydrate foods with a lot of fiber. It would be preferable to eat yam than to eat polished rice. It would be preferable to eat local rice than eat polished rice, in the case that you have to eat these things. And whilst your healthcare provider is giving you a dietary plan or recommends you to see a dietitian, there is also the need to give you the right combination of medications that would work. In orthodox treatment, you have metformin, you have glipizide, you have a long list of medications. You have insulin for those who have type 1 diabetes or a type 2 diabetes that had eventually become type 1 diabetes. So you are given insulin to manage it. So your healthcare provider assesses your situation before they take a treatment plan that best works for you. So see a doctor, don't stay home. It can be deadly, it can be very, very harmful. So you don't self-medicate.
If you just joined us, this is Health Zone on vibetownmedia. I have in the house Dr. Yakub Yusuf, Medical Director of Kojach Medical Center, right here in Accra, and the topic for discussion is diabetes. Okay, so back to gestational diabetes.
Okay.
I've had instances, I've witnessed some situations where women would say, I've never had diabetes. I've never had it from day one. Nobody can say I have diabetes. I mean, there is this misunderstanding between medical staff and pregnant women when it comes to gestational diabetes. So I would like to use you to use this medium, this platform, to educate some of the women out there, not just the pregnant women, because some will also eventually may get pregnant. And we have to seek some clarity from you as far as gestational diabetes is concerned. So please, what is gestational diabetes?
So as mentioned, gestational, it's descriptive. When a gestational period is a period between conception and giving birth. So a woman, in humans, that period is 9 months. Within the 9 months, which in weeks is 42 weeks, there could be a lot of complications. Anything can happen depending on your body composition. No two human has same genetic stamp, even between twins. So at the end of the day, what I will develop when I'm pregnant is different from what person B will develop when they are pregnant. Bring your mind to the fact that there are people who all of a sudden, when they are pregnant, develop a test for food that they usually did not like. Foods they don't want to eat when they were not pregnant. But once they are pregnant, they can eat it almost always. This is an indication that during pregnancy, your body composition is no longer the same. Against this backdrop, genetically, your body could also predispose you to conditions that could, one of it being gestational diabetes. In many cases, it's not permanent. It's just transient. That is, within the period of pregnancy, There are people who even develop hypertension and complications like eclampsia, preeclampsia, which is usually also related to pregnancy. So you meet people who tell you, I got this hypertension when I was pregnant. This is to tell you some of the risks that you are exposed to during pregnancy. So when a medical officer, when a midwife tries to explain to you that your sugar levels are out of control, so you have to see a doctor to manage it, the best is to rest your hopes on them, because these are the people you go to. These are the people who would deliver you when you are ready. If you are in doubt, you could seek a second opinion. It's something I recommend a lot. Sometimes I have conversations with people, they do certain labs, and I'm able to reach a diagnosis. But then sometimes they're in doubt, they're in denial, which is something we confront or see very regularly in medical practice. I tell them, okay, go to another hospital, see another doctor, don't tell them what is wrong with you, explain similar symptoms as you've explained to me, allow them do their investigations, and reach a conclusion. And in many instances, a second opinion would confirm the position of a second doctor. In some cases, yes, maybe it will be inconclusive, but do be rest assured that doctors know what they are doing. And if you are in doubt, you could just go to another trusted facility just to confirm. Once it's the case, a second facility would confirm that, yes, you do have this. And it's gestational, it's just within the period. In some cases, there are those who continue with the increased sugar levels, even after they've given birth. We've seen some of those instances, but majority of the cases, after you give birth, the diabetes goes and then you are returned to normal.
Okay, so to buttress what Doc is saying, in a nutshell, we are saying, yes, it is possible for a woman who never had diabetes to get pregnant and then develop diabetes.
Yes.
Thank you so much for
You're
the
welcome.
clarity. So right now, what I want to find out is what danger signs a diabetic should look out for to know they are heading towards a crisis.
Okay.
Yeah.
Thank you very much. Usually, if you haven't succeeded in bringing your sugar levels under control, you could develop a crisis. And it could be very, very complicated. As I speak with you, there is a client, I prefer to call them client, that we are working with. The person is at Upper East region, and the person, because of the emergency, we had to arrange for the person to get to Bolga Regional Hospital. Now, sometimes people do not want to take their drugs because of a lot of myth, especially men. It's been conflated by a lot of men that when you take some of these medicines for a long time, it makes you impotent. Metformin is not the same thing as hypertension. Metformin or any other diabetic or glucophage or any anti-diabetic medication is supposed to help manage your sugar levels. Should it go beyond normal, a whole lot of things could happen. You could experience psychosis. Psychosis is confusion. You just realize you are not well coordinated. You realize that you probably are short of breath. You are unable to breathe well. And your sugar level, should you check, is off the roof, 30s, 40s. And there is a need for emergency. So for people who would be watching this, you shouldn't even wait for it to get to that time where you start experiencing confusion or difficulty with breathing or restlessness, which is some of the things you see if a person is heading towards a crisis. And once there is a crisis, you could develop something called diabetes ketoacidosis. In this state, there is so much poisoning in the system that you could go into a coma. And in coma, whether you'd survive or not, the doctors can only do their best. So the best is not to even allow it to get to that point where you could develop a crisis and then probably go into a coma and then, God forbid, lose your life over something you could effectively manage. If you are managing your sugar and it is not going down, tell the doctor. People have a tendency of, oh, I took this medicine, it's not going down, so I'm tired, I don't go to the hospital. Because maybe they don't feel immediate symptoms. But then your sugar levels are high. Sometimes people get a cut, and that is when they will know some of the real dangers of diabetes. Because with a cut, a very small cut could become a very big wound. Because in diabetes, it does something to your body's ability to heal, such that once you have diabetes, once you have a cut, it becomes very difficult for the wound to be treated. You need professional wound dressers and cleaners to be able to monitor the wound and make sure it heals. So I don't know if I've been able to provide the necessary information,
Yes,
but then I got slightly carried away there.
I think you have. You've exceeded expectation. Okay, Ramadan is fast approaching. Another important issue I want us to discuss, and I know some of our relatives who are diabetics are getting ready to also take part in the fasting in the holy month. What word of advice do you have for such people who are getting ready to enter into Ramadan?
Okay, Ramadan is coming, and it's a time where millions of Muslims around the world would stay away from eating from dawn to dusk. Within this period, we don't eat any food, we don't drink any water. So questions might arise. My doctor has given me a medication. My doctor gave me a medication to take at 8 o'clock. And then the next one I should take at maybe 5 o'clock or 6 o'clock. But these might not fall within the time that I'm supposed to abstain from food. Can I still fast? Again, we go back to the issue of going back to a healthcare provider. Speaking to a healthcare provider who understands the severity of your sugar, your diabetes, he could recommend that you could take the medication just before the call for prayer. That's when you are eating in the morning. You could take your first dose, and then when the fasting ends, you take your second dose. And that is not even enough. A healthcare provider who knows what he's doing could even monitor you for the first couple of days to see how those times that you take your medication affect you or affect your sugar management. Secondly, you have to eat well. There are people who during fasting is a time for them to lose weight. So they eat very funny food, they eat very little. You have to eat very healthy. As mentioned earlier in this interview, I talked about eating whole grain, eating food, vegetables, fruits and vegetables, particularly foods that are low in sugar. So during the time of fast, you have to drink a lot of water, because from morning to evening, you don't get to drink any water. You might be urinating really regularly, as one of the things diabetes does to you. So drink a lot of water, such that in the afternoon you don't get too thirsty, such that you have to end your fast. And worst case scenario, if you are having a very, very aggressive diabetes, which requires you taking certain course of meal, then I think the scholars are best to answer this relative to if you are supposed to take medications throughout the day to keep your sugar levels within normal. The scholars, I think, have explained that you can abstain from fast if there is no other way out. But then, if your diabetes is not that aggressive and you still want to fast, speak to a healthcare provider. He would give you a regimen. He would monitor your sugar levels because of the change in time for taking your medications, which didn't used to be the case. Thank you.
Very useful discussions, very insightful, very educative. I just don't know what to say. We've learned so much in just some few minutes, and I'm so happy Dr. Yakub is in the house today. We are almost wrapping up, and we'll ask him for his final words and recommendations.
Okay. Thank you very much. I'm happy availing myself to share this with the public. Thank you for the opportunity. For my final words, I would say that the world is advanced well enough to help manage health conditions effectively, from infectious diseases to non-communicable diseases. If you go to the hospital, you will get treated. Don't get carried away with the wrong information. It's an era of technology where you have a lot of people telling you that they have the cure for a lot of things, or they have the perfect treatment for a lot of things. Monitor and take yourself very, very seriously. Go to the right people. There are certified facilities that have what it takes to take care of you. If after some time you think you don't have a trust in a particular facility, you can as well go to another facility. And never sit at home and ignore the health conditions. Never self-medicate. Medications that you're not, this medication, somebody brought it from Yugoslavia. It's been reported to cure diabetes. You have to take it for 3 months, mix it with snail saliva. It would fix it. I've seen people take all manner of things in the bid to cure certain types of diseases. In this instance, we're talking about diabetes. It can be treatable. Your sugar levels could be within perfect range. All you have to do is see the right professional and eat the right food. Thank you very much.
Thank you so much, Dr. Yakub. Well, viewers, this is where we call it a wrap. Thanks for joining. Join us same time next week. Bye-bye.
Showing this and every Wednesday at 4 p.m. on Vibetown Media.